We've had a question in from someone living with diabetes, and the question is, what measures can I take to lower my risk of kidney disease because I'm living with diabetes? We had an expert, a nephrologist, Professor Ibe Irikasima, with us previously, and here's what he said in response to that question.
So that takes me finally to the conclusion that these tips can help your kidney health on track. So regular physical activity, lose weight if you need to, eat less fat, keep your blood pressure, blood sugar, and blood fats under control, which we've mentioned in the last discussions. Check urine for protein regularly with your healthcare professional. If you have diabetes, stop smoking, reduce alcohol intake. Now keep well hydrated.
So there, Prof. Irikasima has gone through some top tips about what people could do to reduce their risk of developing chronic kidney disease whilst living with diabetes. Joan, is there anything you think that you want to expand on from that list, or any comment you want to make?
So probably a couple of comments, Bernadette. As you know, we're passionate about prevention within this series, and it has been one of the most important aspects that I think has run through every episode that we've done. And Professor Irikasima has really outlined for us those basic principles which time and time again actually are so important in terms of prevention. So the only things I would expand on is what we call as healthcare professionals multifactorial risk and multifactorial treatment. So Prof. Ibi talks about keeping your blood pressure, your blood sugar, your blood fats under control. And I think I mentioned this in the episode that, quite often people would say, well, why do I now need a statin or treatment for my cholesterol? Why do I now need treatment for my blood pressure? I haven't got a problem with my blood pressure. But it's so important to treat all aspects of risk to minimize the risk and help with in terms of prevention. So that's one comment I'd like to make. The other comment I'd like to make is, again, I think I highlighted this in the episode about checking the urine for protein and how important that is, and people not realizing how much information we can get from that simple test. So it's really important, if you're asked to provide a urine sample, which you should be if you're living with diabetes at least once a year, please do ensure that you bring that into your healthcare team.
Wonderful, thank you. That was extremely clear, Joan, and really emphasizes the more important, or the key points from what Prof. Ibi Irikasima has mentioned. Moving straight on to the next question, we had a question from a family member, someone living with diabetes. Can a person living with diabetes slow down the onset of dementia with healthy diet and lifestyle? And to answer this question, we had the fantastic Prof. Sam Siedu, who answered this question in a previous event. So let's hear what he had to say.
What I was saying, Joan, was that study that was recently published looked at patients with dementia and looked for the risk factors, and they found there were 12 risk factors that accounted for about 41% of all the cases of the dementia. And these 12 risk factors included things like depression, social isolation, diabetes, air pollution, physical inactivity, smoking, obesity, excess alcohol, hypertension, hearing loss, and poor level of education. And these were all together contributing to the 41% of all the cases of dementia. Now, within this risk factor profile, what they found was that a decrease in 50% risk of each of these led to a reduction in about 7% of the risk of developing the dementia, which is good. And indeed, what they also found was that there were some of the risk factors that were more associated with the risk of dementia, far more than others, especially in certain ethnic groups. And those were things like hypertension in the Black population, obesity, physical inactivity, and indeed diabetes. So controlling this would actually not just help with your diabetes, but will also help reduce your risk of developing dementia.
And Joan, I really love the data that Prof. Samsidu shared there, because it's so in line with the previous advice that was given by Prof. Ibi Iruksima. I was wondering if you wanted to comment on that or anything else that Prof. Samsidu said in the video.
It was wonderful to have the evidence to back up what we are saying generally anyway, that these things are vitally important. And sometimes in a way, it seems that they're too simple. So there must be some, complex, complicated thing that we can do to improve matters. No, actually, those simple things are so highly effective and with a strong evidence base behind them. So the things like weight, the things like physical activity, the things like high blood pressure, the things like not smoking, all of those things, massive amount of evidence behind them. So that's the message that we will continue to provide in order to help people to prevent these conditions in the first place.
Thank you, Joan. And like you said, sometimes they seem too simple, but I'm going to challenge you here, John, because we had a question in from another person living with diabetes about what is the one single change that you would recommend to prevent diabetes if you only had to make one change. I wonder what your view is on that.
So, of course, as Prof. Ibi said in the beginning, there were a list of about 10 things there. Prof. Seydoux is also giving us another list. If I'm going to pick out one, I think preventing excess weight would be the one thing that I would suggest. And that in itself has a number of ways of doing that, but I think that's probably the thing that I would suggest.
Absolutely. I think that's a great suggestion, because if someone's doing that in a conventionally healthy way, that would include lots of physical activity. It would include a diet that's rich in whole proteins such as meats and fish, for example. I mean, the list could go on. I think it's a great suggestion, Joan.
And also, Bernadette, I think that we're coming to the knowledge that there is a critical weight for each of us. There's a critical weight for us as perhaps as a community, and we talked about that in season 1. But I think there is also a critical weight for each of us. So we can't look at somebody else and say, well, I'm smaller or whatever than that person. No, it's a critical weight for you, at which point your metabolism doesn't work as efficiently as it used to. So yeah, I think that's probably the one. If I'm put on the spot, that's the one I'll choose.
It's a tough question, John, and of course, beautifully answered. So before I show the snippet, I would love to move on to a question that was submitted about oral health complications. And I think often when we talk about diabetes and its complications, we know about the kidneys and the heart and things like dementia, but oral health is not something that's often discussed. And so, I mean, in your experience working and seeing people living with diabetes, is it something that people would raise with you? Would you have to proactively raise it? It'd be great to have a little bit of background before we go into the video.
Sure, and I think that this is the reason why we wanted to do this episode, and we're really grateful to Dr. Sarah Kasasa for doing this, because it is an often neglected topic. A lot of people don't realise the association between oral health and diabetes, and don't recognise that the diabetes can impact their oral health and vice versa. So it was really great to have her to highlight this, and I'm so pleased that we were able to do it this season.
Absolutely. So let's hear what Dr. Sarah Kasasa had to say.
The best way to make sure that you keep your mouth in optimal health is firstly to visit a dentist on a regular basis, so that anything that's actually taking place before you are aware of it is actually picked up. So regular dental visits whereby they actually examine the teeth and examine the oral tissues generally, and so can pick up things much earlier and then treat them if necessary, but also give you the necessary advice to prevent ongoing problems. The other thing that's relatively important is actually own personal oral hygiene. So most people know about brushing their teeth. We all know you should brush our teeth. But there's a difference between brushing your teeth and how many times you brush your teeth or how you brush your teeth. So this information is quite important to actually get it right. But also, in so doing, it's also looking at different aids as well as brushing your teeth. So, for instance, interdental aids that would actually clean in between the teeth, because these are areas where there are little pockets where the bacteria can actually stay. And furthermore, apart from actually doing that, is making sure that your diet is obviously also in the right place, so that the kind of foods that you eat are not going to actually increase the chance of you getting any dental disease, or actually impact maybe your diabetes as well. So it's really a combination of things that are really important for people to do on a daily basis, on a regular basis, to make sure that prevention is definitely better, because some of these situations can actually be treated early enough before they become a very serious infection, because in some cases, the diseases of the mouth become chronic. Once they become chronic, you're almost in an irreversible stage whereby some of these conditions cannot now go back to what normal or optimal health is. You now can lead to tooth loss, and which is a significant issue for most people, because it affects being able to eat, it affects being able to smile, it affects speech, and generally, you can lead to a lot of pain as well of that.
And I think that clip from Dr. Casassa is so wonderful and clear, and it emphasizes the importance. It affects your ability to eat, affects your ability to smile, it affects your ability to speak. So clear that, this is something that could be avoided. And I love that she gives clear steps. Joan, I'd love your thoughts on what Sarah has shared.
And also, one of the other important things she said about, which we always talk about with prevention, you want to prevent it becoming irreversible. So with a lot of conditions, if you catch it early, you can prevent things either deteriorating or actually developing a particular condition. And what you don't want is for that condition to become irreversible, where then you're sort of limited in what you can do about it. So yeah, she beautifully illustrated that as well.
Mm-hmm. And I think an important aspect to mention is that we are aware, I guess you could say myself included, that going to the dentist is something that people might not be so excited to do, but that people working in that field are used to that, and there's many things that they can do to help make the experience as pleasant as possible. And I think I don't know if you can remember from that episode, Joan, and any of the insights that Sarah gave that we could share perhaps.
Well, I think she used things like music, obviously chatting, a comfortable environment, all of those things. And I think what we have to emphasize also is that going to the dentist now is not as it was many years ago, when it was such a scary experience. That there are much more user-friendly environments, let me put it that way. So yes, and she was very reassuring about that.
Absolutely. And I one thing that I remember from that episode is she said, tell your dentist or your oral hygienist that you're feeling nervous. Let them know, and there's things that they can do. And I think she's mentioned that communication of that about how a person's feeling can go a long way to help addressing any of the things that might make someone nervous. So I thought that was a great takeaway from Sarah on that one. On to another under discussed topic, and we had a wonderful speaker, Dr. Isioma Okolo, and because we had a question in from a person living with diabetes about preventing or addressing sexual dysfunction that's related to diabetes. Joan, I'm going to play the clip and let's discuss afterwards.
We want to all be aiming to live as healthy a life as we can. And specifically with diabetes and sexual health, this involves paying attention to your weight. I have a bit of resentment for the so-called body mass index.
Yeah.
Oh yeah, you do as well. So, it's a number, is it valid in certain communities? I don't know. I'm not sure. I think what is important to pay attention to with your weight is how much weight are you carrying around your core? So the weight we carry in our tummy area, this is called a visceral fat. And this is fat that is metabolically active. So this is the kind of fat that it will increase your risk of conditions like diabetes, certainly poor control of your diabetes, poor heart health, high blood pressure, This is a reflection of cortisol. This is how your body's processing the stress hormones. So I think it's important to, look at your body. I am very pro body positivity, but look at your body and just take a step back and see, where am I carrying this excess fat? If it's in the tummy area, not because we all want bikini bods or whatever nonsense, absolutely not. It's that this is the visceral metabolic fat that will get us. So that's what we should aim to lose. I don't pay too much attention to scales or BMIs, but that's me.
I mean, I'm sure we wouldn't all mind a bikini body, but anyway, I do like the fact that Dr. Isiomokolo's advice is linking and agreeing with your one choice about controlling one's weight or being at a healthy weight for an individual. Joan, anything you want to add to that before we go on to the next question?
Well, again, just to re-emphasize, if we looked at the first clip from Professor Ibby and the list that he gave, and we looked at this list that Dr. Okolo had given as well, the similarity between the two, just to emphasize, these are key principles. Yeah, we will keep plugging them because this is where the most effective way to prevent and help these conditions actually sits.
So we had the fantastic Dr. Sam Botchley and also Leona Williams joining us talking about exercise. And so we had a question coming in from a healthcare professional about what is the impact of exercise and how much exercise is effective. So let's play that clip now.
Sam, I'm going to ask you, everybody living with diabetes, are they able to start physical activity?
So I think the important thing, this is probably the most important slide actually. Most people are able to do physical activity, but the why is really important. For people that have type 2 diabetes or have a risk of having type 2 diabetes, and we know that people in Black and African communities are specifically more at risk of type 2 diabetes, they can reduce their risk of getting diabetes and the risk associated with diabetes by up to 50%. Now, if I was to say any medication could reduce anything by 50%, I think everyone would take it. So if I could, package exercise in a bottle and hand it out, I'd be giving it out for free because it's literally the miracle cure. And just a small amount of physical activity is really important. Now, I know a lot of people have concerns about starting physical activity, and because of that, there's been a lot of research recently about whether anyone can do physical activity. And you're not going to be surprised by my answer, but anyone can do an increased amount of physical activity. The research has shown even for people with long-term health conditions such as cardiac problems or kidney problems, the benefits far outweigh the risks. And the risk of these adverse events that people worry about that stop them doing the physical activity is actually very low. And I know people don't feel like that, but that's what the science has shown. So really important to get that message across that everyone can do physical activity.
Fantastic, clear explanation there from Dr. Sam Botchley. Joan, anything you'd like to add there?
Well, just that at any point in your life, you can increase your physical activity. So there is evidence to show that when you're in shall I call it middle years, increasing your physical activity has cardiovascular benefits and other wider health benefits. And even when you're in your autumn and winter years, let me put it like that, yes, you can still get benefit. Whatever point in your life, if you increase your physical activity, it has so many health benefits. Of course, we're talking about diabetes. Of course, we're talking about either improving that condition, helping to prevent that condition. But, we could be talking about blood pressure. We could be talking about mental health. We could be talking about so many other conditions which are improved by physical activity of some sort. So just be as active as you can.
Absolutely. And I agreed. And as you mentioned previously, anything is better than nothing. So people sometimes feel, oh, I'm not going to do my couch to 5K, as you mentioned earlier, Joan, but actually walking to the shops or taking a few steps rather than the escalator is going to have a benefit. And I think that's actually wonderful. It's so great. The final clip for this section is really related to blood glucose levels and what targets someone could aim for to reduce the likelihood of diabetes complications. And we had the fantastic Grace Vanderpool, MBE, nurse consultant in diabetes, discussing with Joan on that topic. So let's see what they had to say at the time.
So we should really aim for blood glucose levels of between 4 and 7 fasting, in general terms. And I think by doing that, we then know that our patients are less likely to have, to get the complications of diabetes, providing they stay within those levels. We know that even though they have good levels, they can still get the complications. So just to set that record straight. And then, Diabetes UK very clearly points out, and I believe NICE as well, that, 2 hours after food, then we should be looking for a blood glucose level of 8 or 8.5.
Yeah, so Joan, you've maintained consistently throughout all our work and all our events that target should be individualized to an individual's circumstances. But it'd be great to hear your thoughts on the discussion that yourself and Grace had previously about the targets to look to aim for to avoid complications.
Yeah, I absolutely hold to the fact that it has to be an individualized target because we are all so different, and the outcomes that we're looking for, the levels that we're looking for are going to vary depending on that person and their circumstances. So the figures that Grace gave were a ballpark figure. They are ideal, but they are ideal for certain individuals in certain circumstances. Now, you can say that in relation to the person's age, you can say that in relation to the person's occupation, you can say that in terms of the person's social circumstances. There are a number of aspects that you'd have to bring in to make these individual targets. So yes, of course, those are some ideal figures. It's a ballpark figure, but I will always hold to the fact that the individual in front of you, together, you work out what their individual targets are going to be.
Moving on to the Ask Me Anything part of the event, where we're going to have a broader range of questions that we're going to answer. Interestingly, there's a point which links directly to what we've just discussed about targets. And that was from our Learning to Advocate for Yourself event. And we had Daniel Newman, a person living with type 1 diabetes who's also had a kidney transplant, was just giving a bit of background about how he was discussing individualizing his glucose levels that he's going to target with his healthcare professional team.
And whilst you're about to play that, Bernadette, what I would just add is that I think Daniel illustrates this as well in the clip, that his target at a particular time may be a certain figure or figures, but that may change. And that's why I think it's so important that we talk about these individualized targets. Is there something that you can advise people how they might agree and work in partnership with a healthcare professional to agree those, what we call hard targets?
Yeah, I think one that really comes to mind, particularly when advocating for yourself and agreeing blood glucose targets, is there was a point where I was meeting my diabetes consultant in a meeting, and he spoke to me about my blood glucose levels, and he wanted my targets to be, I must caveat this, I'm not a healthcare professional, so this isn't healthcare medical advice, but he wanted my levels to be between 4 and 7, and he wanted to be that to be my overall target. And in the time leading up to this appointment from the last one, and I think for quite a few years living with diabetes, that was my target, and I was just aiming for perfection. My quality of life wasn't what I wanted it to be. I was feeling disappointed. It took its mental toll on me. And actually what made me feel better was having my targets between 4 millimoles and 10 millimoles. And that's what worked for me. And when we had a conversation about it, he was like, oh, well, it's not between 4 and 7. And I said, well, the reason why it's not between 4 and 7 is I've noticed that when I've aimed for that, I've felt really down. I've aimed for perfection and it's affected me. I'm not enjoying, it's having a wide impact on the way that I feel and how I'm living. And I feel comfortable and I feel happier with my targets being between 4 millimoles and 10 millimoles. Now, I've left it quite broad, but for me, that was about advocating for myself because I didn't have necessarily the data to back up how I was feeling, but I had my lived experience to say, this is how I'm feeling. And I don't want to feel this way when living with the condition. And for me, that's about being aware of what's going on and what's right for you, but then also having that confidence to speak in that setting and say, no, actually, I want to do it this way.
I so love that clip from Daniel. Joan, what do you think?
Yeah, I think Daniel really expressed it beautifully, how to advocate and how to work with your healthcare team. So in the first part of the clip, he was saying that the healthcare professional had suggested this, had suggested that, had suggested the other. But when he went back for the appointment, it was Daniel himself who was advocating for himself and explaining to the healthcare professional and working with that healthcare professional to agree a different target range, let's call it that, one that he could live with and one that would be acceptable to the healthcare professional as well. So he negotiated that, and I think he sort of illustrated advocacy in a fantastic fashion just with that clip.
Absolutely. And the reason we actually included that clip is we had a question coming in from a person living with diabetes asking the question about why do some healthcare professionals act threatened when they're speaking with someone who advocates for themselves. And I think we can see from that video how it can be perhaps challenging if a healthcare professional is seeing what good practice is and then a person living with condition is asking for something that deviates from that. And you can see that healthcare professionals probably have the best intentions for the person, but it is about that mixing of the person's own experience and also the targets which the guidelines are sharing. Joan, anything briefly to add on to that before we move on?
No, just as you said, it's about the theory and it's about the lived experience and bringing those two things together so that you can give the person the best advice that you can possibly give them to empower them to live the healthiest life that they can live, but they are living that life and we have to absolutely respect that and work together.
So we've been going through the questions that people have submitted when they're registering for this finale, but please be active in the chat. Put your questions and comments, and we're going to discuss those with Dr. Joan St John later on in the event. Just one or two more videos before we answer your questions that are coming in the chat. So next we've had an event previously with Douglas Tunifor, who's the head of Care for Diabetes UK, talking about type 2 diabetes remission. And we had a question coming in. Type 2 diabetes remission, why should I aim for it if it's not necessarily possible for everyone? And so we're going to share with you Douglas's answer to that question. We also had Daniel Katambo joining us from Kenya.
Douglas, anything you wanted to add?
So just a few general comments from me, which is that one, remission is possible. It's possible within different communities. It's possible within people from Black backgrounds. Remission provides hope for both clinicians, but also people with type 2 diabetes. And even if you're not able to achieve remission in the immediate term, we should be encouraging our patients to look at remission as a journey. And any effort that you put in to lose the weight will give you some benefits. The benefits might be that your HbA1c will get better. The benefits might be that your medications, the doses may be reduced, or some of the medications may be taken off. The benefits ultimately could be that you will come off all your medications, diabetes medication, and the benefits will be that you will achieve remission, which is a great place to be for many people with type 2 diabetes.
So clearly shared by Douglas. I actually love that clip. It's wonderful, and it's something that you've always supported, Joan.
Yeah, and I think Douglas illustrated the fact that it's a journey. It's not about the destination, but when you're going along that journey, there are benefits that you can gain. So whether or not it's, as he said, that you're able to come off all of your medication, or you're able to reduce your medication, you're able to reduce your HbA1c, you're able to reduce your weight, you're able to improve your blood pressure. All of those aspects may be a possibility along that journey. You may not get to the ultimate of not having any medication or an absolute remission. However, there's still major benefits that you can get by attempting that process. So I think that would be my answer, because it's general principles that we've been talking about before, which will reap some benefits. So even though we call it attempting to achieve remission, and it's not remission that you achieve, you still will gain some benefits. So that's why I would say it's worth trying.
Absolutely. I completely agree with what you said there, Joan. And I guess the last snippet from this segment, and I think actually it has a thread through pretty much every single topic that we've discussed today. And the question actually came in is, why is women's sexual health downplayed in general? And I think it could be relevant to a lot of the other topics. But let's just hear what Isioma had to say on this for this question.
Why is diabetes and women's sexual health rather downplayed in clinical practice? Isioma, you and Joan, you discussed it earlier in the presentation about some of the challenges perhaps in training. But do you feel that element of potential shame or stigma impacts healthcare professionals as well?
Should I go first?
You go first.
Go first. Well, where do we start with this?
Yeah.
We don't even have enough time to unpack this. Why is it downplayed? I think it is downplayed because female sexuality is controlled or policed in a way that is a reflection of society's perception of what our values or virtues are. And that is fed by a lot of stigma, culturally. But the basis of it is a lack of awareness, right? So of the individual, of the professionals. And with stigma, things are, people feel uncomfortable talking about things that they don't know. And as a professional, if I don't know, you've come to me and I'm an expert. And if I can't answer your questions, why will I ask them? Why will I put myself in the situation? So there's that discomfort. There's also the time element. Dr. St. John, you can testify to this. I don't think people appreciate the kind of pressure our GPs are under in the UK. Globally probably, but I can only speak from the perspective. The time you have 10, 15 minutes, which of these symptoms are you going to address? We have a bit more time as hospitalists, but still not enough time, not enough staff. But anyway, it's education, it's lack of awareness. And I think it's fear and shame, which has historical roots in the way female sexuality is policed and governed around virtue, lack of virtue and cleanliness. And we need to stamp on that and boldly proclaim that this is good health. It has nothing to do with promiscuity or whatever. This is a very important part of our health. And we, as a provider, I am challenging myself to ask questions, because you ask questions and you make people more comfortable to actually say, oh, actually, yes, this is the case and this is the reason. And then you open up spaces. And then obviously really grateful to Diabetes Africa for hosting this talk. This is a big deal to be talking about this on this platform. So thank you.
Absolutely. And like I said before, I think it cuts across many things, many of the topics that we've been discussing in this event about the interaction between the person living with the condition and the healthcare professional, shame, stigma, advocating for yourself, perhaps time pressures. There's so much there. Joan, quick word before we start answering the questions from people in the chat.
And the other aspect I would add to that, Bernadette, is communication. That's the only other thing I would add. But yes, it underpins all of those things and highlights all of those aspects as well. And you know, we can talk about healthcare professionals or healthcare teams feeling threatened as well sometimes. And I think that this topic particularly illustrates that fact.
Yeah, absolutely. Thank you, Joan. I completely agree with what you've been saying, and actually, for those of you who are wondering where we got these snippets from, you can actually watch the full event for where the snippets were taken from on our YouTube channel. We're going to put the link to our YouTube channel in the chat. Please have a look and subscribe, and you'll be able to get access to any new videos that we release, and also watch the videos in full at your leisure whenever you have availability.